COVID impact on? Definitely, it was the students who were the most affected. Along with the students, the teachers were affected, the parents were affected, the management was affected, and finally, and the most importantly, the patients were also affected. So let's see how were we at the receiving end and how did we try to cope up during this time. That's why I have divided this presentation into 5 sections. I call it the ABCDE, where A stands for adjusted curriculum, B stands for biosecurity measures, C stands for clinical experience, D stands for delayed graduation, and E stands for emotional well-being. So these are the major 5 things that saw a drastic change because of the COVID-19 pandemic. So coming to the first thing called the adjusted curriculum. And most of you here are students. You have been in the dental school when the COVID was happening. So you all know how the learning technologies changed, right? We completely shifted to the computer or mobile interface. We came across a lot of new softwares like Zoom, Moodle, and Google Classroom, just to name a few. I'm just taking this presentation from a lot of Western literature also. So there they shifted to virtual microscopies, simulators, so that to improve the motor skills, especially in restorative dentistry and prosthodontics. Then there were even virtual reality mobile apps where they were taught periodontal procedures. And there was a virtual meeting with simulated patients who were mainly actors, so that the students get to know how to take a case history, etc. So these were the major changes that came as far as learning technology was concerned. And the way the lectures were delivered also underwent a major change. I think all of you will agree, this was a major change, right? From classroom-based teaching, it came to home-based teaching. So that was what we call as a synchronous lectures, which were live lectures. Then there were asynchronous lectures, where the students were asked to view the recorded videos and other complete online modules. Then there were new teaching methodologies like flipped classroom, which is basically when the students were asked to learn about it and then come and attend the class. So a lot of such innovations, rather not innovations, a lot of these things were attempted during the COVID-19 pandemic. So this was the first online class that I took when the COVID-19 was declared. But while there was excitement in the beginning, after a while, this was what was happened, right? So the expectation was different, while the reality was completely different. We have seen all these memes that were circulating from the social media of how the online classes were actually going on. But nevertheless, that was the only option that we had in front of us. And now I think we are back to offline classes in most of the places. And not only the classes, even the exams had to be restructured, I would call it. So there were online assessments using a lot of softwares like Google Forms, etc. Then there was most of the thing from essays, it shifted to MCQs. And there were proctored exams, like all your internal exams were conducted with a live camera on, and the faculty were proctoring from the college as to whether you are doing your exam properly or not. So these were some of the changes that came as far as examination patterns were concerned. And then there was the era of webinars, right? We have lost count of how many webinars we have actually attended during the past 2 or 3 years. So all your seminars became webinars, all your CDs became webinars, and even our conferences became online conferences. So at the end of 3 years, we have a lot of certificates. We've improved our CV, but let's see how that has really translated into practice or not. And then there was a component of research as far as post-graduation curriculum is concerned. All non-essential and clinical-based research projects had to be suspended, right? And especially the PG students would have taken a big toll of the PG students, because midway to their projects, where patients were involved, they could not continue them. But on the flip side, the researchers or even the faculty, the students, they had more time to work on publications, especially if there were any publications that were left in the middle. They had a lot of time to revisit those publications, and definitely our publication count increased in the last 2 years. And most of the studies shifted from clinical studies to secondary data analysis and things like systematic reviews and all that. So this is what happened with research, and unfortunately, some of the PG research at the last moment had to be dropped, and they had to search for new topics and finish it in about 6 months or 1 year's time. So it had both the sides as far as research is concerned. The next major, or rather the most important change that came was with regard to the biosecurity measures. The infection control drastically improved, right? We all knew what was infection control, but definitely the practice improved only because of COVID-19. The immediate response, as I told you, was lockdown. If I remember right, at least our institution, we were in the lockdown for about 2 weeks. But after 2 weeks, we had to come back because we had to provide emergency care. Because initially, we were made to understand that the COVID would not last for more than 2 weeks, but that was not the scenario. So emergency care had to be given. We had the responsibility towards patients. So we tried to do a lot of things just to make sure the COVID does not impact us. We started thermal screenings and travel histories of the patients. We decided not to perform elective treatments and perform only emergency care. We prepared isolated rooms for treatment where there is no aerosol spread to the outside. Then we started rapid antigen tests before the procedures. Actually, this is a photograph from our own institute. Then we started fumigation. Every 2 times a day, there was fumigation that was happening in the clinics. Then we split ourselves into 2, where one part of them worked for a week or 2, and then the next set of faculty came. There were a lot of measures because we didn't know how to handle this. We were facing this for the first time. So a lot of them were trial and error, but this was the best that we could do given the situation. And once that acute phase came to an end, then we came to a phase called as phased reopening, where N95 became the order of the day. You started wearing PPEs, respirators, and I'm sure most of the colleges in India would have shifted to scrubs when we were using aprons before. And because of this COVID, it has all shifted to scrubs now. Hand hygiene and antiseptic mouth rinses, such practices increased for the good. Then there were also many other measures that we took, like for example, high volume suction, all such things. If we could afford high volume suction, the clinics and the colleges afforded that. If you didn't have the finance, you resorted to the good old exhaust fans. Okay. So then that was about the biosecurity measures. Then what happened with the clinical experience of the dental students? This was something which affected the most. I think all of you would agree, those who are doing your internships and post-graduation here, definitely would have gone through this case where the clinical hours were compromised, right? So dentistry, you all know, is the skill-based course. So practical training is very much important. In fact, more than the theoretical training. So there were a lot of missed hours of clinical practice. Because of that, there was a decreased self-confidence in clinical skills, right? So this has been reported in a lot of literature. And we also call them the COVID batch, right? The last 2 batches which passed out will be henceforth known as COVID batches. So definitely it has caused a dent in their self-confidence and also a fear of the future. Like, are they equipped to handle the dental clinic independently is a question mark. So there was a fear of the future also among the students. Medical postings got affected because they also had the same scenario. The dental students were posted in COVID wards and they were posted for COVID control activities. Again, we can use them in a positive sense also, that they had the training to even undertake such jobs. And from time to time, there were a lot of advisories. There was no dearth for advisories. The institution had an advisory, Dental Council had an advisory, all the international organizations had advisories. So we had guidelines as to how to go about during this phase. Then, especially for preclinical teaching, I think there were a lot of teaching was shifted to procedural videos and case-based discussions, problem-based learning, and especially in European countries, there was a increased use of clinical simulators. We don't see that much in India. It's not there. There are few institutions who are using clinical simulators to teach dentistry, and this I think should be viewed as an opportunity, because we need to heavily invest on clinical simulators in case we are having to face any such contingencies in future. And because of all these reduction in clinical hours, and since we were not sure whether the students have got the adequate experience to pass out, there was a delay in graduation, right? At least for a few months, and in a few countries, it was even deferred for up to a year. So there are universities which deferred graduation even up to a year. And some universities on the positive side offered bursary grants to students, because especially abroad, dentistry is a very costly affair to learn dentistry. So there are a lot of students who are going into debts because of the because they had to extend it to a year. So some universities gave them grants so that they could complete it without much expenditure. And there were, in some universities, even started centers like urgent student clinics, which was basically for additional training. After you pass out, something like a bond with the university, you get to work in an urgent students clinic where you get more exposure to the patients. And graduation ceremonies, definitely, they had to be cancelled, they had to be rescheduled, or they had to be completely moved online. So one or two batches could not have had the graduation ceremony, which you were actually hoping for. And one of the most disheartening aspects of COVID-19 was with respect to the emotional well-being. Right? It is very much discussed in literature, but it is something that we don't talk about very common. Right? So anxiety and stress among students. According to a multi-country report in 2021, halfway into the pandemic, 35% of the dental students had anxiety. And students, rather, there's a scale to measure anxiety. It's called the perceived stress scale. And according to the scale, most of the students experienced moderate to high level of stress. And what were the major stressors? One was infection related. That is, there was a fear of contracting COVID-19 during patient care among the students. Then there was education related, because when you quickly had to adapt to virtual learning, and when you didn't have time to complete the requirements, when you didn't have time to hone your clinical skills, even when you transitioned back to the clinical training, there was a lot of difficulty. That was one of the major stresses pointed out by the students. Then there were social related stresses, basically the social isolation. A lot of people rather got themselves isolated because for 2 years there was not much interactions happening. And there were financial concerns, definitely, with respect to the career, the job, and the overall uncertainty. Right? For almost a year, we were in complete uncertainty, not knowing what will happen next. So these were the major anxiety and stress parameters that was reported in most of the literature. And coming to the mental health support, sadly, our schools, our dental schools, or even the medical schools, at least in our country, we lack the adequate mental health support. It is there in a few Western countries, but not as good as but in India, it's not as good. So, and there was a fear of getting infected by the virus, as I mentioned before. There was a loss of close acquaintances, maybe family members, their friends due to COVID. That was a major emotional issue that the students had to deal with. And how did they cope up? Definitely we all cope up, and that's why we are all here. There were a lot of reasons, there were a lot of coping strategies that were actually given by the, that were mentioned by the students in the literature. One was definitely watching movies. I think all of us still have a subscription of Netflix and Hotstar and all that. It increased during the COVID-19 period. And we indulged more in social media. And a few health conscious among them shifted to physical exercises and yoga. And we got to spend more time with the family because the classes were happening at home. So that is one of the positive aspects. But one major negative aspect that happened because during the coping strategy was the addiction to drinking and smoking. This was reported in literature where students resorted to drinking and smoking as a coping strategy. And the effects of it, we'll only be knowing it in the future. So this was all about the students, but as I mentioned in the initial slides, students are not the only stakeholders. So we need to have a look at other stakeholders also. With this in mind, we decided to conduct a study in our institution, which was titled Attitude and Perceptions Regarding Online Teaching in a Dental Undergraduate Program during the pandemic. This took into consideration not only the students, but the other stakeholders also, like teachers, parents, the management, and also the patients. So I'll just be highlighting the major inputs that because it was a mixed method study. That means there was a quantitative component and there was a qualitative component also. So I'll be highlighting the major information that we received in the qualitative component. So from the teachers, the most common opinions were there was absence of guidelines and standardization as to how to take an online class. Immediately we shifted to live online classes. But since we were also facing it for the first time, we did not have a guideline as to which all classes should be taken online, which should not be taken online, etc. And judging the students, I think all of you would agree, was very difficult. Even though you could see their faces on the screens, but it was very difficult to understand whether the students were actually following you or not. And they were, the teachers suggested that they needed training on new teaching and learning methodologies, and also to even operate the new learning management systems like Moodle and Google Classroom. These are all actually very good softwares, which is being used in many other countries. Like most of you would have been doing a lot of online courses using Coursera, Moodle, and all that. But definitely, since we were caught off guard, they did not have the training, and so they demanded training on these aspects. And the student-teacher interaction was the one which was affected very much. Then coming to the parents, we had a few interviews with the parents of the students, and what they felt, the major concern was definitely their lack of practical training, right? Because again, being a skill-based profession, they need to set up their clinics after they graduate, so this was definitely affecting them. And the parental involvement in education improved. Since students were learning from their homes, the parents had a watch on what the students were learning. So that aspect was something which improved. And regarding financial burden, there were contrasting opinions. Some of them felt that they did not have to invest anything additional because of COVID, but some of them had to buy new laptops for their works and all that. So it incurred a little bit of financial burden for the parents also. Then coming to the management, I think they had a very tough time. They had to make a lot of infrastructural and engineering changes in the dental schools, because they had to ensure the safety of students not only in the colleges but also in the hospitals and the common areas inside the campus. So there were a lot of restrictions, right? We were told that the students cannot go for even marriage parties or any other functions. They had to go for a function, they had to come back and undergo an isolation period. It might sound that we were curbing their freedom, but we had no other choice, right? So sometimes extreme measures were taken, which slowly became diluted as time progressed. So, but I'm just saying that some of the students felt that we were curbing their freedom, but we had no other choice. And then the management also had to improve on the delivery of online classes. A lot of infrastructure changes like setting up of labs, setting up of cameras, all those paraphernalia related to online classes had to be done. And finally, with respect to the patients, how do the patients get affected? By patients, I'm trying to talk about the patients who come to the dental school as far as this presentation is concerned. Definitely the cost of care increased because the patients had to undergo an antigen testing before a procedure was performed. You just imagine a situation, because generally in a dental college, a restoration would cost you about 100 rupees. And they had to undergo an antigen testing of 600 rupees to get a procedure of 100 rupees. So the situation improved from 600 antigen cost came down to 300 and 100 and all that. But definitely it was an additional burden on the patients. The cost of care had to be increased. And I think this point is valid even for clinical practice. Right? We were wearing personal protective equipment, so we had to hike our clinical charges also. And there was a lot of issues regarding the infodemic. I think you're all aware of this term called infodemic, where a lot of information is there and you don't know which one is true or which one is false. And there are a lot of fake news propagating in the social media especially. So you had a lot of patients coming to you and asking you questions regarding COVID-19 and all that. So there's a lot of information was being generated in the social media, which definitely the patients came to know about. So, and also patients also had fear of contracting COVID-19 to the dentist itself, because there was a point of time when it was told that dentists were very prone to get COVID-19 because we work in very close contact with the patients. So patients purposefully delayed the appointment, and also even if they had pain, they delayed the appointments fearing that they would get a COVID from the dentist. So such are the situations that were happening. And generally, there was a delay in all treatments. Only elective care was not performed. Only emergency care was performed. And because of that, there was an increase in unmet needs. And slowly, I think we are overcoming that. Patients are frequenting clinics now. The patients are frequenting the colleges now. So probably in another few years' time, we'll be able to overcome this issue. And as far as outreach programs are concerned, because I'm a public health dentist, so as far as outreach programs are concerned, it completely came to a standstill. We could not conduct camps and other outreach programs because patients coming to camps also had that was one of the patients that come to the college mostly come from camps also, right? So if there were no camps, definitely our patient inflow was also getting affected. And camp was one means where poor patients could get dental care, and that almost completely stopped. So it came to a standstill, and probably for the past last 1.5 years, now we have started on these programs once again. So to summarize the whole COVID-19's impact on dental education, I try to put them into 3 headings: the good, the bad, and the ugly. The good, what happened is, this crisis offered dental schools an opportunity to leverage technology in new ways so that the dental education can be improved. Infection control practices improved drastically, and something which I am very proud of, public health got its due. Right? All of a sudden, everybody was talking about public health for the past 3 years. And coming to the bad, the clinical care and training got affected, but it's something that we can overcome. And we had to consider a lot of other methods like simulation, demonstration, teledentistry, which took a while to get on track. So for some time, the students were definitely affected. And like I mentioned, the cost of dental care also increased. And the ugly aspect of it, especially relates to the mental stress, that is loneliness and social isolation among students. Some students went into depression. High-risk behaviors like smoking and alcohol students started indulging in such behaviors. Stress and anxiety increased, and also worsening of the financial situation, at least for a few households. So with this, though I decided to end it with ABCDE, I wanted to end it on a positive note also. So I decided to add an F as to what is the future. So what is the future? Is COVID-19 an opportunity? Can we convert the COVID-19 into an opportunity for us? Yes, because now that we have started distance education, I think that is going to be a game changer. In a few years down the line, we might see some of the courses being shifted completely online, and we might be going to dental schools only to get the practical training. I'm not saying in the immediate future, but definitely such thoughts would have already come up in the minds of all the educationists. And there was a blended learning. That's exactly what I was speaking about. The practical sessions could be conducted in the college, whereas the other could be in the form of asynchronous and synchronous sessions. Teledentistry came up, it increased, because this will definitely reduce the patient appointments time. As far as dentistry is concerned, it's a little bit difficult compared to telemedicine. But at least your first visit to the dentist will be avoided, or a consultation at least will be done using teledentistry, and they can come to you only for the procedures. And there were also calls, I got this from an article from US regarding dental emergency needs to be made a formalized curriculum. Like how you have for medical emergencies, how to manage medical emergencies. Even dental emergencies could be made into a curriculum, and you could have a separate workforce for managing dental emergencies. So these are some of the opportunities that I thought about, right? Because some good things that we can take out of what we went through for the past 3 years. So these are my references. With this, I end the presentation. Thank you.
Thank you, sir. You have thrown the light on the topic, which is act for the present. And leaving apart the negative aspects, I think we can assure COVID-19 has created a positive impact on our health, sir. I request the chairpersons to conclude over the talk.
And as a human, we are always very adaptive. Challenges come and we overcome that and become a better person. Thank you. Excellent presentation. A true recap of past 2-3 years we have gone through. Then one more thing I would like to add. Dentists were recognized as the best hand in doing nasal swabs. We were recognized. So good presentation. Thank you.
Definitely, sir. Especially even the dental students and postgraduates who manage the antigen testing centers in the schools.
And hospitals also, we are doing that. So.
Thank you so much. I request the chairpersons to present a memento as an appreciation to the speaker.